For a man to get a healthy erection, it requires 5 things. So you need to have healthy erectile tissue. You need to have a healthy hormone milieu like testosterone. You need to have healthy arteries to bring blood into the penis, healthy veins to take it out, and healthy nerves. So an injury to any of these can impact a man's erectile function. And diabetes not only impacts the arteries, the veins, or the nerves, but diabetes can also lead to low testosterone. And so it's impacting 4 of the 5 things that impact erections in men.
Welcome to the Erectile Dysfunction Radio Podcast. We are back with another episode. Today we are joined by Dr. Helen Bernie. Dr. Bernie is an assistant professor of urology and director of the Male Sexual and Reproductive Medicine program at Indiana University. She is also the Andrology Fellowship Program Director there. Her practice specializes in men's health, erectile dysfunction, Peyronie's disease, prosthetic surgery, hypogonadism, male infertility, fertility preservation, and cancer survivorship. Dr. Bernie, thank you very much for being with us today.
Thank you so much for having me on the show.
Yes. So the topic that we want to get into today is diabetes and its impact on erectile function. To get us started, can you give us an overview of diabetes? There's diabetes type 1, diabetes type 2. Can you tell us what those are and who do they primarily impact?
Absolutely. So diabetes is a problem with the metabolism of sugar in our body, or glucose, which is what almost all of our food gets broken down into. Now, there's 2 different types. There's type 1 and there's type 2. Type 1 is a genetic condition that most people are born with. And this is where the body's own autoimmune cells attack your pancreatic insulin cells or beta cells that produce insulin. Insulin in our body is what is needed to bring sugar into our cells so we can use it and that we can get energy. So type 1 is where you either don't make or you have very little insulin. And it can be, people can die from this. And so it requires lifelong insulin use. Type 2 is acquired, meaning it's usually due to our lifestyle. So it's more common in people that are obese, people that have poor habits, that eat a lot of sugary foods, things like that. So it's an acquired condition that we get where our body can no longer use the insulin well or make enough insulin for us. So again, type 1 is genetic and you're born with it. And it's where you either don't have enough of or you don't even make insulin. Type 2 is where our body can't use it or make enough, and that's usually due to lifestyle factors, obesity, things like that. So it develops later in life. And unfortunately, in the U.S., with our obesity epidemic, type 2 diabetes makes up about 90% of diabetics in our country.
Wow. Okay, so you're saying about 90% of diabetes is much more of like lifestyle, life choice driven.
Absolutely.
In terms of weight management, weight control, lifestyle control, and about 10% is the genetic type.
Correct.
Okay. Now, just to help myself and the listeners better understand, so can you just go over what role does the insulin play in our bodies?
So insulin is what helps take glucose or sugar, what our food is broken down into our body so that it can be used for energy and so that we get nutrients from it. So if we're not able to bring glucose into our bodies, then all kinds of bad things can happen. You feel fatigue, you feel tired, people can pass out, and in fact, people can die. They get a condition called diabetic ketoacidosis where our bodies get acidotic, and it can be a life-threatening condition.
Okay. So in layman's terms, where does that sugar go if I'm a diabetic and I'm not producing enough insulin, and assuming I'm not medicated, and I eat a piece of candy or a popsicle that's loaded with sugar?
That sugar is just going to hang out in our bloodstream. So it's going to hang out in our bloodstream and it's going to go all over our body, hitting our arteries, hitting our veins, just hanging out in our bloodstream and not going where it should be going to be used.
Okay, so the insulin basically has a method of being able to extract that from the bloodstream, put it away in storage for when the body needs it. Without the insulin to do that, you're saying largely circulating in our bloodstreams and getting to all the wrong places at best.
That's right. Insulin's our transporter. It's the car that picks it up and takes it where it needs to go.
Got it. Okay. Now that helps me get a much better understanding. So to that end, what are some of the common complications associated with diabetes and in particular, I would say with mismanaged or undermanaged diabetes?
So people that have poorly controlled or untreated diabetes, sometimes we call it a silent killer because initially you won't feel bad. You won't notice that anything's wrong. Just like high blood pressure, you're going to feel fine. You're going to walk around. As it starts to worsen or decline, people can start feeling lightheaded or dizzy. People can start dropping weight, actually. And then the more long-term complications is that because you have so much sugar in your blood supply and it's injuring the arteries and the veins in our body, it ends up causing end organ failure. What does that mean? Well, blood is sent to all the organs in our entire body, right? It's how we nourish our body and bring oxygen and nutrients to every part of our body. So long-term complications of having diabetes can impact your eyesight. People can go blind. It can impact your kidneys, can hurt your kidneys to where people need to be on dialysis or even need a kidney transplant. It can result in kidney failure. People can lose sensation in their fingers and their toes and their feet and their legs because it impacts the nerves in the body as well. It can injure our nerves so that we get what's called peripheral neuropathies, or where you can't feel things well. You have numbness or tingling in the hands and in the feet. Well, if you can't feel things well, you can't tell if you have a little rock in your shoe or your shoe's tied on too tight. So then you can get wounds and sores on feet. People can have amputations and lose toes. You can lose your feet. You can lose your legs. These are just a few of the side effects of someone that has poorly controlled and long-term diabetes. But regarded to sexual side effects, it can impact erectile dysfunction. It can impact your ability to have an orgasm. It can impact your ability to ejaculate. There's so many things. Diabetes is really, it impacts the entire body, and it can impact it in a very drastic way.
Okay, so Dr. Bernie, to that end, you were mentioning damage to arteries, and whenever we're talking about erections and sexual function in general, the arteries are certainly a primary feature of healthy blood flow to the penis. So to that end, can you maybe just describe for our listeners a little bit about how this damage occurs, and in particular in the very small arteries that are associated both with the eyes and with the penis? Like, how does the sugar impact that blood flow?
So I like to give people the analogy, like pretend we're all in a middle school classroom or a high school classroom, and you're standing in the middle of the hallway of that school, and it's 2:59. It's like a minute before school is about to get out. And that hallway has no one in it, and it's nice and calm and quiet. And maybe you see one or two students come out of the classroom to go to the bathroom, come back in. And that's how your arteries should look with blood. You have as needed, a little bit gets released. And then all of a sudden, that bell rings at 3:00, and those classroom doors open, and everyone comes running out, and they're all walking down the hall, and they're banging into the lockers, and they're hitting up against the wall while everyone's grabbing their bags and hurrying and getting out of the school. That's the analogy that you can think of that happens when you have too much blood sugar in your body. And so it's just beating up and damaging those arteries and veins and nerves. And by doing that, it creates injury. Well, one of the ways that our body helps heal injury is it lays down plaque or calcifications, and it lays down these, for lack of a better word, think of it like lipids, kind of things like bandages that kind of help. And so as you continue to get these injuries in your artery and your veins and your nerves from too much sugar hitting and just beating up against the walls of the vessels, what happens is it starts to either leak. You get blood that leaks out of the arteries, which impacts erections, and I'll kind of go into that a little bit. Or you end up having it where you get narrowing or stenosis of the arteries. Well, when we think about it, the arteries to the penis and the eyes are smaller arteries. So it takes less blockage for us to see an impact in those end organs versus like the heart or the lungs that have larger arteries. And in fact, I'll tell you, we'll talk about it, but, erectile dysfunction is oftentimes a harbinger for cardiovascular disease. And it's for that same reason, is that we start to see the signs or symptoms of erectile dysfunction much sooner than cardiac disease because you have smaller arteries. And so when they're 50% occluded or 50% blocked off, we're going to see an impact in the erectile function. Whereas it takes that same amount of plaque, it takes more to get about a 50% occlusion in other larger arteries in our body. So that's really kind of where we start to see that and why we have these injuries and the arteries, the veins, or the nerves. For a man to get a healthy erection, it requires 5 things. So you need to have healthy erectile tissue. You need to have a healthy hormone milieu like testosterone. You need to have healthy arteries to bring blood into the penis, healthy veins to take it out, and healthy nerves. So an injury to any of these can impact a man's erectile function. And diabetes not only impacts the arteries, the veins, or the nerves, but diabetes can also lead to low testosterone. And so it's impacting 4 of the 5 things that impact erections in men.
So to that end, I mean, I know that obesity can have other implications for erections, but generally speaking, if a person comes to you and they are noticeably, overweight, leaning towards obese, and they're reporting erectile dysfunction, is diabetes something that you are going to check for or be concerned about in that kind of patient, or generally speaking, would other symptoms already be present? So I guess what I'm asking is, could erectile dysfunction be the canary in the coal mine for diabetes, much like it is for other cardiovascular conditions?
100%, 100%. And so when I see patients that come in to see me for erectile dysfunction, part of our AUA, or our American Urological Association guidelines, recommend getting testosterone levels. And I check their testosterone levels. And I actually also check a hemoglobin A1C on all of my patients, because low testosterone can be a result of elevated hemoglobin A1C and many other things. And there's so many men that don't know, right? We know that most guys don't go to the doctor. And that's why I love my job, because I may be the first person that they've seen, because sex and infertility are really strong motivators. And so if I can get a guy to come in to see me, and they're coming to see me for erectile dysfunction, then I can really check everything else. I can get a lab panel on them. I can look at their lipids. I can look at their hemoglobin A1C, which is a 3-month marker of someone's blood sugar levels in their body, their glucose levels. And then that's where I can really make a difference, because I can help counsel them on preventative things that they can do to help improve their overall health. Because while we have tons of treatments for erectile dysfunction, if you don't take care of your diabetes, that's going to kill you. So yes, 100%, erectile dysfunction can be one of the first signs of diabetes, of cardiovascular disease, and a whole slew of other health conditions that are really important to be checked in men.
Yeah. Is there anything about the way that a diabetes-induced erectile dysfunction presents that would make it different or more unique than other causes, or does it look largely the same?
It looks largely the same, because, again, it's one of the 5 things that can impact someone's erectile function. It's either the hormones, the nerves, arteries, veins, or the healthy erectile tissue. And any one of those can impact, and many of them all at once can play a role. It can be an artery and a vein problem. It could be a nerve and an artery problem. It could be a hormone problem. But they're all going to present the same way, with that you have erectile dysfunction. So you either have trouble maintaining or achieving an erection sufficient for penetration.
So, Dr. Bernie, you mentioned before that the sugar plays a role in either causing leakage, some kind of damage to the arteries, and the self-healing process could cause calcification, or with like a lipid bandage, we'll put that in quotes, but things that will narrow the artery flow over time. So, in particular with type 2 diabetes, if a person goes ahead and makes lifestyle changes, is the damage done to the arteries something which is found to be reversible, or once the damage is done and the arteries have been narrowed, that's the way it's going to be?
Yes and no, depending on the severity of how badly they've been damaged, and for how long someone has had diabetes, and to what degree of control, right? Has it been poorly controlled for 10 years? Or have they, done a pretty good job taking good care of it, and just only in the last couple years or months, have they had poor control? So it really depends on the duration of how long they've had diabetes, and how well they've kept their blood sugars controlled, of whether it can be reversible or not. And young, healthy guys that are coming to see, that maybe don't even know they have diabetes, there's so many avenues and areas that we can really implement preventative measures that can reverse damage that has been done by diabetes. And I always tell patients, I'm like, if you take good control of your sugars, and you're able to keep them low and keep your hemoglobin A1C levels low, below 6, then it's almost like you don't have diabetes, and you're not going to have the complications of poorly controlled diabetes and the end organ failure that we talked about earlier. But it's all about how well you control your sugars. And that's really important to do.
Okay, so to that end, with a patient who has been making good faith efforts to try to manage their diabetes, but it's been going on for a while, and their numbers are higher than 6, or whatever your preferred number may be. What is the impact, generally speaking, of the use of, let's say, an oral medication like a PDE5 inhibitor, a Cialis, a Viagra, for somebody who has had arterial or venous damage over the
Some
course
patients,
of managing diabetes? Yeah.
Yeah, no, great question. So in patients that have diabetes, they're actually going to be 2 to 3 times more likely than someone that doesn't have diabetes to get erectile dysfunction. And then their erectile dysfunction is less likely to be treated by common standard measures like PDE5 inhibitors or that little blue pill, Viagra, Cialis that we all hear about. So in patients that have diabetes, about 50% of them may not even respond to pills anymore because of the damage to their arteries and veins and the erectile tissue health.
Okay, so to that end, what treatment options would be available to them? We've covered obviously a slew of treatments, including urethra suppositories and trimix injections. There obviously are implants, vacuum devices. If this is a blood flow issue to which a PDE5 inhibitor is no longer effective, would that be true for other forms of intervention that are intended to encourage blood flow?
No, so PD5 inhibitors like Viagra or Cialis, or sometimes the generics that patients may hear more commonly, like sildenafil or Tadalus, they require an intact nervous system to work as well. So you need to have an intact nerves to the penis in order for the PDE5 inhibitors to work. And what those medications do, they're vasodilators. They're going to increase blood flow and oxygenation to the penis to help either achieve or maintain an erection sufficient for penetration. So, there's no harm in always trying with these and starting with these first. If someone has had diabetes or has been poorly controlled, either with the duration or how it's been controlled with the blood sugar levels, that pills no longer work. The good news is that we do have other options, and these can include something called penile injections or intracavernosal injections. Those work directly on the tissue, and they do not require an intact nervous system to work. But penile injections can be used. There's many different names for those too, alprostadil, trimix, or bimix, that can be used to inject into the side of the penis. They typically work in about 10 to 15 minutes, and they can give a man an artificial erection. Other options would include using something called a vacuum erection device, and that's an over-the-counter device that you can either buy online or at a shop. And it's a hollow tube that you're going to put over the penis, and using a hand or battery-operated pump, it's going to create a suction. And then that's going to draw blood into the penis, creating an erection. Then you're going to take a constriction band that's going to be placed at the base of the penis to kind of act like a tight hand grip that's trapping the blood into the penis so that the patient can maintain an erection sufficient for penetration or sexual activity. When neither injections, pills, or a vacuum erection device work, we have something called a penile implant that when done by someone like me that's a high volume implanter, it is a same day, quick outpatient procedure. It usually takes less than 45 minutes, and patients can go home the same day. It's oftentimes touted as the gold standard for men that have refractory erectile dysfunction.
Okay, that was a really, really helpful overview. So just to understand, because this has been like a question that comes up a lot, and it is hard to kind of get clear. So with the trimix, does that not require the arteries to deliver blood? Like how does the trimix kind of overcome these barriers that the PDE5 inhibitors seem to run into?
So no, great question. Everything does require blood. For a man to get a natural erection, you get aroused, you get turned on, your arteries dilate, blood goes into the penis stretches, and by blood going into the penis and filling up the smooth muscle, that smooth muscle or the corporal erectile tissue compresses on veins, trapping blood into the penis. Then after a man has an orgasm or an ejaculation, those veins open back up and blood goes out of the penis and the penis becomes soft. So the physiology of all of it is still the same. Now, the difference with injections is that they're a little stronger medication that act directly on the penis, whereas oral medications, any pills, they're absorbed in our body systemically. So they take about 30 to 45 minutes for full absorption after you take it on an empty stomach. And then what it does is you still have to have sexual stimulation. So you have to be aroused. You have to have an intact nervous system that sends the triggers of arousal to send the nitric oxide and everything else, all the chemicals in our body to cause vasodilation of our arteries and increase blood flow. So all it does is it helps increase blood flow. What your injections do is there's several medications that are together, like, for example, trimix or bimix, where you have alprostadil, phentolamine, papaverin. You have all of these together that are working to cause vasodilation, so it's a little bit stronger to increase more blood flow, acting directly only on the penis. It's not systemic and acting throughout the rest of the body. to work and do it. And we can go up on the dosing of the medication, of the injections, as needed for patients. In fact, one of the side effects of the injections can be something called priapism, or a prolonged erection lasting greater than 4 hours, which is considered a medical emergency. So, we can, there is such a thing as too much of a good thing, where the medication can actually act too well on some men and cause more of an erection than we actually want them to get, and more than they want to get. But it just depends, again, on the health of the erectile tissue, the arteries, the veins, the nerves in the body.
Okay, so in other words, if there was a full blockage in the artery, like, which obviously would be problematic for other reasons as well, I want to be clear.
Yeah.
But theoretically, if you had a full blockage, you're saying a trimix also would not resolve that. It's just a question of to what degree and how vasodilated these arteries are becoming.
Yes, and some of the medications also help with vasoconstriction to trap blood into the penis as well. So there's something called veno-occlusive dysfunction that can occur with diabetics, and that's where we get something. Veno-occlusive dysfunction used to be called venous leak. That's not really the correct term for it, but it's where instead of the veins clamping down and trapping blood, a little bit of blood leaks out and it continues to drain, so that the man may get an erection, but it's just not as rigid as they want it to be. They're like, I feel something happening there, but it's just not staying there. Or one of the most common things they'll complain of is they'll say, Doc, if I'm standing up or I'm on my knees, I'm okay. But if I lie flat on my back, then I lose my erection. And that's really kind of a telltale sign of veno-occlusive dysfunction, that they have leakage of blood instead of, it's not a problem with blood flow going in, it's a problem with the blood staying in.
Very helpful. Thank you. I really, really appreciate that clarification.
Yeah.
So how does erectile dysfunction impact the mental and emotional wellness of men who are diabetic?
No, absolutely right. This isn't just a physical thing. This is not just a physical medical condition. This is an emotional condition. These men feel loss of confidence, loss of masculinity. There's a significant correlation of depression and anxiety in men that lose their erections. And all of a sudden, it really changes the dynamics for those that are coupled or partnered. It can drastically change those dynamics. So, this isn't just something where it's a physical problem that can be treated, but this impacts the whole person, and on a deep level. This really is something psychological. It's something that, most men have grown up all their lives waking up starting at, age somewhere between 12 and 14, where they see an erection every morning when they wake up, and all of a sudden they don't have this. And it's something that's many times associated with their masculinity or their manhood or their ability to take care of their partner. And it really can lead to devastating side effects. So I think that's one of the most important parts of my job too, is helping normalize this and letting them know that we have treatment options for this, and that we can help take care of this and restore their intimacy and restore their sexual health again. Because as you mentioned, it's not just a physical problem like a broken leg or a broken knee, but it carries a lot of psychological consequences and baggage with it.
Do you find that any of your patients that you've encountered are more motivated to make lifestyle changes or address diabetes, I'd say, more holistically, meaning in addition to medical intervention when necessary, but to make the lifestyle changes for the sake of improved sexual function or wanting to avoid experiencing pronounced sexual dysfunction in the future?
Absolutely. Again, I think sex and infertility can be extremely strong motivators for men. And I kind of always tell them in the office when they come to see me, I'm like, I can fix your erections. I can put a penile implant in if none of the medications work. But if you don't fix your diabetes and you don't take good care of yourself, you're going to lose your eyesight. You're not going to be able to see your partner. You're going to lose sensation in your penis, so it's not going to feel the same. You're going to lose your ability to orgasm or ejaculate because of the nerve damage from your high blood sugars. So, you're going to lose your ability to walk, to get to your partner, to pick your partner up, to embrace your partner if you don't take care of your diabetes. And I think by letting patients know this, I think, again, it can be really strong motivators for improving their overall health, especially patients that are already partnered and have a healthy relationship or have a partner that, they're sexually active with or want to be intimate with. Again, I think all these things play a really big role in helping motivate them to make these lifestyle changes that not only are going to improve their sexual health and bring great intimacy and pleasure, but are also going to improve their overall health. And that translates into their longevity.
Okay, so speaking of partners, if a man comes in with his partner and the partner is, upset or concerned or distressed or even worrying about, her partner or or his partner. What do you usually like share with or say to the partner of a man who's experiencing ED and diabetes?
So, sex is a two-way street, right? So when someone comes in and brings in their partner, whoever they're intimate with, I love it because then I can address it both ways. If it's a male partner, I can ask about top, bottom, or versatile. I can ask about their sexual practices, which, helps me know of how best to take care of them and how to treat them and what their goals are. If it's a female partner, I can say, is sex painful for you? Because if I fix an erection and she's postmenopausal or she needs estrogen therapy and she's not on it, then I haven't made anyone better. I fixed one problem and created another one. So I love it because I can normalize it for both of them, right? Most of us aren't taught about sex in school, right? Like we're taught about abstinence or pregnancy. And then even in pregnancy, we can't even talk about breastfeeding and mastitis and all the other bad stuff that can happen, right? Because we live in the US where it's not open to talk about these things. And so what I love to do is I like to normalize it because I sometimes have couples where they tell me like, I'm broken. I've never even had an orgasm. I can't. And it's because they don't even know, or they don't even know how to, or they don't even talk to their partners to tell each other what the other one likes or needs because they're not comfortable talking about it because maybe due to religious reasons, background reasons, how they were brought up, society, all of these things impact your ability and comfort level with talking about sexual health. And, where someone maybe grew up with shame or guilt, or even, patients that have had sexual trauma or abuse in their history. So I love getting couples. I could talk about this for a whole nother hour because then I can really see like, where are you guys? Is this something y'all both used to enjoy before? Or have we ever had problems where, maybe there's a libido or a desire discrepancy or a mismatch? So it's not always just about an erection, right? So when I bring them in together, we can talk about it. We can normalize it. I can help them talk about it together and communicate and what the goals are for the couple. And then we can talk about how can we incorporate healthy lifestyle things to improve everybody, to make all of us feel better, to make us all live longer, and when you have a buddy, that accountability takes over and it makes it a whole lot easier, right? Like if someone's trying to quit smoking and their partner's still smoking, it's really hard to wake up in a house where you constantly have your partner still smoking. So if I can kind of talk to both of them about the importance of it and lifestyle and show them that this is something that's doable and little baby steps every day are how we're really going to see the end result. That's just a strong motivator. And that's really why I went into my field, because I feel a little bit like I'm a primary care doctor in a surgical subspecialist field. But I get to make the changes there. And then, you see them the next day in the office and they're the next time in a follow-up and you've changed everything and you can like see it in their eyes and they're like so excited because you took the time to talk about that instead of just being like, here's pills or here's that, go, see you later, but you really kind of bring it all together.
Yeah, it's a very rewarding experience. Certainly when it has the impacts like you are describing. So, Dr. Bernie, to wrap things up, I want to ask you, what advice would you give to a man who has diabetes and is beginning to experience impact on sexual function, let's say in particular erectile dysfunction? What would you advise or counsel this person to do?
So number one, go see a doctor, right? Go see a doctor. So many men don't go see a doctor. Men die, 7 to 8 years earlier than women on average because they don't go see a doctor and they're not plugged in early. So, sometimes my patients that have very poorly controlled diabetes, I'll say, who's managing your diabetes? And maybe it's a primary care doctor who's doing an amazing job taking care of them, but their sugars still kind of are a little out of whack, right? Because that primary care doctor is having to take care of every condition and everything. So I may tell them, maybe we need to look at getting you a specialist, like an endocrinologist, someone who's going to just focus on your diabetes. Or maybe we need to get you in touch with a diabetic educator, someone who can help you incorporate changes into your lifestyle with diet and exercise that make it more manageable for you so that you can actually be healthier. It may require medication dose changing, but the most important part is go see a doctor. And if they're not already seeing, someone that specializes in diabetes, I usually will refer them to that if they've had poorly controlled diabetes. And then I talk to them about lifestyle changes of what we can do. So if they're smoking, that's an absolute stop smoking. What can we do to help you incorporate exercise and eating a little healthier? Everyone thinks you have to do everything at once, but you don't. Like do a meatless Monday. Start with, instead of eating red meat, cut out red meat, and only eat chicken. Try to eat more of a plant-based diet. There's a lot of different ways. And now luckily there's so many different food delivery services as well that are more affordable. And Even organic foods don't have to always cost tons of money. There's a lot of great affordable things. I kid with people, but if you have a Trader Joe's by your house, like you can get a whole week's worth of food for under $100 for like a 5-member family at Trader Joe's. They really do make healthy food affordable. And so, maybe start that habit with your partner. Again, this is where it's great if you have a partner accountability because, but you don't have to have a partner for this, but after dinner, go for a 5-10 minute walk after you eat. That just little things to start incorporating: diet, exercise, quitting smoking, getting better sleep habits, stress, meditation. Who isn't stressed? But all of these things impact our health and our overall longevity. And, when they're first starting to notice ED, that's when we can really work and reverse this. I mean, there's a very popular book out by Dr. Dean Ornish, that talks about reversing cardiovascular disease by a plant-based diet. And I mean, you can do the same with a diabetic. You can really help reverse this and really improve their overall health, and they'll feel so much better. It's really wonderful.
Sounds like, again, that those small steps really can add up, because I can understand, anybody who's been on the receiving end of a diagnosis, that really needs to be managed in the long run. It feels overwhelming, right? It feels like almost like, where do you begin? But yeah, that small steps, I mean, I really, really appreciate that, because, so much of this is about the long haul, and it's about like managing and maintaining and developing those habits in ways that are sustainable. Right, taking on small things, small steps,
Absolutely.
one at a time, really, really can make a big difference. Dr. Bernie, thank you so much for being with us. It's been a topic we have been asked a lot about, and we've been looking forward to covering for a while. I found like your insights and your explanations to be really, really like clear. Helped me to get a better understanding of like diabetes, what the impact is, and how these interventions like really kind of tie into this condition and how it impacts erection. So, thank you very much. We look forward to getting this episode out to our listeners.
Thanks so much for having me and for talking about such an important topic that impacts so many men.